Hi, good morning. My name is Jose Miranda Velasquez. This video is for BSN 346-04. This is the Healthy Pregnancy and Prenatal Education video. Prenatal care typically involves regular visits with the healthcare provider throughout the pregnancy, and this is done to monitor the health of the mother and the fetus. It's also done to identify complications early and to provide education and support. Early and consistent care helps ensure appropriate fetal growth and maternal well-being. Most uncomplicated pregnancies follow a general schedule for provider visits. Week 4 through 28, an expecting mother can expect to visit the doctor about once every 4 weeks. Weeks 28 through 36, it's about once every 2 weeks. And then weeks 36 to birth, it's about once every week. I do want to mention that high-risk pregnancies may require more frequent monitoring and more frequent visits. Most visits include routine assessments such as measuring blood pressure and the weight, or vitals, checking the fetal heart rate and growth, otherwise known as the fundal height, and assessing for swelling or any symptoms of edema is also done. Urinalysis or blood testing is done as needed as well, and this is overall a moment to answer any questions and provide any education for the expecting mother and or parents. These evaluations help detect complications such as hypertension, gestational diabetes, or fetal growth concerns. The first visit to be could offer some specific assessments. Often it could include a complete medical and pregnancy history, a physical exam, a pelvic exam can be done as well. This is done to determine the expected due date for the mother. Baseline blood work and urine tests can also be done. These screenings are to help screen for infections or any anemia. Pap tests or any TB screening or HIV screening could be done if indicated by the doctor. These baseline evaluations establish a maternal health status and risk factor for the newly expecting mother. During the first trimester, which is week 1 through 13, blood tests are done to determine the blood type, the anemia status, and infections status or screening. Urine tests are also performed to detect any infection or any protein or glucose abnormalities. Genetic screening can also be done, such as non-invasive prenatal testing. This is usually done after weeks 10. And this is typically they look at the chromosomes and they screen for any abnormalities and such. During week 11 through 13, they can do ultrasound and blood work as well. And this is through genetic testing or looking at the genetics of everything to see the genetic risk. At this time, the ultrasound can help confirm and evaluate early fetal development on the fetus as well. During the second trimester, which is weeks 14 through 27, maternal serum screenings could be done, and this is typically between week 15 through 20, and this is done to evaluate any neural tube or any chromosomal risk in the baby. Typically, around week 18 to 22 is when they do an anatomy ultrasound to assess the fetal structures as well. An amniocentesis diagnostic test can be performed, but this is only done during week 15 through 20, and this is to analyze the amniotic fluid for any genetic disorders as well. If any gestational diabetes concerns arise, the screening for this is typically done during week 24 through 28, and this is to evaluate the glucose tolerance. So these procedures focus on identifying structural abnormalities and metabolic complications, more so for genetic testing as well. During the third trimester, which is week 28 through 40, we continue to monitor the blood pressure and fetal growth and the fetal position at this point. We are preparing for labor and postpartum care, and then any additional testing as needed based on the mother or the fetus and their status. Visits during this phase increase in frequency and focus on ensuring readiness for delivery and detecting late pregnancy complications. A balanced pregnancy diet typically includes vegetables with like spinach, carrots, tomatoes, sweet potato. It could include fruits such as oranges, bananas, mangoes, grapefruit, or grapes. Whole grains. Typically, some some cereals are accepted, or cooked cereals such as oatmeal. Um, for protein sources want to be looked at, meaning leaning meat, some fish, beans and nuts and seeds want to be consumed. And then dairy and fortified alternative milk or dairy products should be considered, like for milk or yogurt or soy milk of such. Fruits and vegetables provide vitamins and antioxidants, and depending on the fruit or vegetable, could have potassium or fiber. Some examples of these are typically citrus fruits, berries, or greens, or colorful vegetables. And this is to help support the immunity and digestion and the development of tissue in the fetus. For the protein, I mentioned the lean meats, the poultry, the fish, the beans, the seeds. This is to help build the fetus, its tissue and its organs. They also contribute, depending on what is being consumed, iron and vitamin B, and this supports oxygen transportation, and the metabolic rate in the fetus. For whole grains, like fortified cereals or grains, they supply energy as well as iron and folic acid, which are both essential during the pregnancy for both the fetus and the mama or the expecting mother. I wanted to mention alternatives for dairy, like milk, yogurt, cheese. You can also, or expecting mothers can also consume fortified plant beverages. The idea is to get calcium and the vitamin D for the fetal bone and tooth development. So wherever it could be consumed from would be ideal. I wanted to talk about foods that should be avoided in pregnancy. And that is like mold rip in soft cheese, like brie or brea. This can contain Listeria, which is a type of bacteria. We want to avoid consuming any animal liver. It may contain large amounts of vitamin A, which can harm the baby. I know marlin and swordfish should be avoided as well due to the high levels of mercury that can affect the baby's developing their nervous system. And I wanted to throw this out there right now that hydration is key. Consuming water and hydrating is very, very, very important. For vitamins and prescriptions or medications, over-the-counter medications and supplements, they could be used. Just really need to be aware of what it is and what it contains. Oftentimes, it's also often said that acetaminophen is safer to use than ibuprofen. Expecting mothers to consume folic acid, iodine, and vitamin D. Most over-the-counters are safe because it can be difficult to meet increased nutrient needs through diet alone. So prenatal vitamins that are over-the-counter are typically recommended. If a mother's having a hard time upkeeping the nutrient intake aspect of it all. For folic acid, the idea behind the folic acid is it helps prevent neutral tube defects affecting the brain and the spinal cord. Folic acid can come from leafy greens or citrus, fruits, beans. Some cereals contain it, but it is important to take it early on in the pregnancy. I wanted to talk about a little bit of iron as well. Iron supports blood volume and oxygen delivery to the fetus. So iron can come from a supplement or a lean meat. Sometimes some poultry is recommended, eggs, um, just a good source of protein. And like I mentioned, supplementation may be recommended if the dietary intake is inadequate or not enough. For calcium, the purpose is it supports the fetal bone and teeth development, and it allows and enables the muscle function in the fetus and then the maternal nerve as well. This can be found in most dietary or dairy products, or broccoli or kale as well. For vitamin D, the vitamin D also helps with the fetal bone and teeth development, and it could be found in both foods or additional supplements that could be taken. It is important to note that additional nutrients within or with increased needs, like as the pregnancy goes on, the nutrient needs for the mother are increased. So going back to the iodine, the zinc, the vitamins, the omega, fatty acids, it's all there to support the brain development and the metabolism. We're looking also into the immune system. We want to have a high functioning immune system. And oftentimes the support is from the supplements, when the mother isn't able to really intake, such. These level of intakes or nutrients are usually established in the pregnancy dietary guidelines that could be set with the doctor or OBGYN. They're typically set forward early on during the pregnancy so that the mother knows what to expect. Moving forward to things that should be avoided. NSAIDs, or any anti-inflammatory drug, should be avoided as they can cause serious blood flow. Let me see. And these serious blood flows problems are, could be caused in the baby if used after week 28. Aspirin should also be avoided. It may increase bleeding in the mother during the pregnancy. I know I mentioned it before with the vitamin A and the vitamin E. It can cause birth defects as well. I feel like I'm missing a piece here. With the vitamin E, we don't want to. We want to avoid it so that we can avoid any heart defects in the baby that we are expecting to deliver as well. I wanted to talk about a little bit about moderate to intense activities for the mother. It is encouraged. For example, brisk walking, swimming, and on the swimming it helps with the gravity too if mom is in the water. Things such as stationary cycling, yoga or Pilates or light resistance training is encouraged, but we want the mom to stay active and not necessarily those. We just need the mom to move. And we're looking to improve the cardiovascular function itself. We don't want to encourage the muscle strength or muscle strengthening in a newly expected mother, and this is only because we don't want to increase the risk of injury. Let's see. And as from what I understand, as you know, an expecting mother, they're um, we don't want to make their pregnancy discomforts worse. We don't want to add to the back pain, so we encourage it. There are other sources of exercise that can be done. Just staying active and moving, essentially, is what we're after. Um, if a newly expecting mother is exercising, we can anticipate about, or we can recommend about 30 minutes per day if they're exercising 5 days a week. I wanted to note that the exercise intervals or the amount of exercise could be divided into smaller or shorter intervals if needed. Um, but we also want to avoid certain activities as well, such as contact sports, like horseback riding, soccer, football, stuff like that. We don't want to hurt the fetus. Um, we also need to avoid scuba diving. I know I'm mentioning swimming, but you know, diving at high altitudes or like descending super low, we don't want that either. Um, we also want to avoid, I know I mentioned hot yoga or Pilates, but it should really be taken into consideration the overheating. We want to avoid any sort of overheating or any exercising in extreme heat conditions. Um, we don't want to dehydrate both the mama and the baby and sweat out all the fluid intake they just worked hard to take in. Um, I want to mention exercising that require lying flat on the back. And this is, I want to mention that this should be avoided, especially after the first trimester, or any exercise that require any breathing where you know, a mom holds their breath during a long period of time as well. We don't want to increase the, pardon, we don't want to decrease the blood flow to the fetus or do anything that's oxygen deprivating to the fetus. And we don't want to increase the risk of trauma or the risk for there to be for the mom to get hurt more so, and of course the fetus. We're looking for the mom to stay hydrated to avoid any overexertion. We want to modify the routines as the pregnancy progresses. We want to stop exercising and seek care if the symptoms are of dizziness or contractions start to occur. During our pregnancy for mamas, weight gain is expected, and it's based on the patient's pre-pregnancy body mass index. A mom is considered underweight if the BMI is under 18.5 pounds. As a, you know, newly pregnant mother, they expect to gain anywhere from 30 to 40 pounds. Normal weight would be anywhere from 18 and a half to 20, about 25 in the BMI range, and that is within the expected gain of about 30 to 40 pounds. And any mother who has their BMI of 25 to 30 is considered overweight, as it is expected that their weight gain is in the range of 15 to 30 pounds. And then obese is anything with the BMI over 30. And it is expected for them to gain anywhere from 11 to 20 pounds. Some of the most common complaints in pregnant women or, you know, newly expected mothers is heartburn. There's increased constipation. There's increased back pain. With the heartburn, the acid reflux, it affects more than, you know, half of the pregnancies, or at least more than half of the pregnant patients, especially in the second and third trimester. And it tends to happen when the stomach acid it flows upwards in the esophagus, causing a burning sensation in the chest. Some relief methods could include eating smaller portions, or just eating smaller and more frequent meals rather than larger meals. Avoid eating 2 to 3 hours before bedtime, and avoiding spicy foods or anything that could trigger, such as greasy, spicy, fatty foods or chocolate or caffeine. We want to elevate the head when lying down, and if none of this is working, I think it's time to contact a provider before you're using any antacids or any medications. Let your doctor know. And these are all like changes to reduce such symptoms and to improve nutritional intake during pregnancy and to avoid harming the fetus. Constipation, I will say, tends to be very common in pregnancy due to the hormones slowing down of the hormones changing the digestion and slowing it down. Uterine pressure on the intestines, and because of the higher supplements as well that are being consumed, everything slows down. Digestion doesn't happen as rapidly. So I wanted to talk about some relief methods, including to avoid and help relieve constipation. With that, some methods are increasing dietary fibers or consuming, fiber through, like fruits or vegetables or whole grains. There are, when that doesn't work, there are alternatives such as drinking stool softeners. And it is stated that engaging in moderate to physical activity can help with the constipation. But going back to the stool softeners or any laxatives, you want to contact your doctor and ask if such laxative is appropriate or okay for this, for the mother to use. It only should be used when needed as well. You don't want to take it consistently and to avoid constipation and it leads to something else. You want to contact your doctor and more so be on the same care plan and on the same page with what is being taken in. Usually they'll mention that high fiber intake and hydration are the first line in any sort of intervention, any exercise, as this may increase the bowel function. I wanted to go back to the back pain. I wanted to mention that this tends to occur later in the pregnancy. And this is due to the musculoskeletal and postural changes associated with the fetal growth and the shifting in the body mechanisms. As the fetus is growing, the baby's essentially shifting, so the mothers are going to be feeling the back pain and the swelling and all the above, all the symptoms. So some of the relief methods here for this that are recommended are rest and using proper body mechanics or positioning while sleeping, or just going about their daily life. They want to, stretch a little more often. It's recommended massage therapy, get a massage every so often. Applying heat or applying ice may be soothing for the newly expecting mother. And really taking like a medication for pain such as acetaminophen, assuming the doctor's okay with it. It should be okay. We don't want to take over the counter medications or any medications to risk to put the baby or the mother both at risk. We're looking to relieve that back pain or relieve any pain the mother may be expecting. So we're looking to generally reduce the discomfort and improve mobility and improve. We're looking to improve the pain and reduce the pain that they're feeling. For a couple things I want to mention, for bleeding, vaginal bleeding or any leaking of fluid as the pregnancy prolong or as the pregnancy is moving forward, mothers may experience some leaking of fluid or bleeding coming out of their out of the vagina or the canal, and this is due to possible miscarriage or placenta previa. At this time, it is often that the abruption occurs and then the preterm labor comes in. So, if I'm sorry, going in a circle here, I'm getting a little bit of a brain fart. So, essentially, the during the placenta previa, there's fluid leaking out of the vagina, which can cause a rupture of the membrane, which causes the water leaking, essentially, the fluid. And this increases the risk of infection or preterm birth. It happens early on in the pregnancy. If this is ever the case, patients or expecting mothers should contact their doctor right away, seek medical attention, so that both the mother, and the fetus can be medically evaluated, and this can be managed promptly. We don't want to put that fetus and both the mother at risk. We don't want the mother to lose the baby. So if any sort of bleeding or leaking is coming out, it's fair enough time to contact your primary care doctor or seek emergency care. Another thing to look out for during the pregnancy is severe headaches, vision changes, or sudden swelling in the face or hands or limbs. We're looking for anything that can essentially tell us any sort of indicator for preeclampsia, and this is typically with any hypertensive disorder that comes with having high blood pressure. So having preeclampsia can potentially lead to organ damage, and if untreated, it could cause seizures in the mother. It could move on from preeclampsia to eclampsia, and for this, it would be threatening both the mother and the fetus. If the expecting mother is getting their blood pressure checked regularly and the blood pressures are high, where it is done outside of their doctor's office, they need to communicate that to their primary care doctor or the doctor treating them during the pregnancy. And this is all in hopes to prevent any complications for both the mom and the baby. We don't want the mom to go into the preeclampsia and have them both be at risk or both be harmed. Lastly, in my video, I wanted to describe and discuss a topic that tends to be a little difficult for me, and this is the decrease or absent fetal movement. For this, the reduction in the fetal activity may indicate fetal distress, or that there's the oxygen supply to the baby is being compromised. Monitoring the fetal movement is very crucial during a pregnancy. This essentially is telling us whether the baby is okay or not. Any decreased movement or anything that seems abnormal to the mother, I would say would be important and would require prompt evaluation from the doctor, such as an ultrasound or, have the baby be assessed Oftentimes, it is looked the other way for this, and it gets to the point where the fetal movement is pretty much non-existent, and other things or other conversations are being had at that point. So it is important to look out for decreased or absent fetal movement in a baby. And newly expecting mothers can expect the movement and can expect the baby moving more frequently as the pregnancy goes on and as the terms increase or move forward. Alrighty, this was a long video. This is essentially my my prenatal care education video. Thank you so much. Bye-bye.